Hello, hello. We're happy to have you back for another YouTube video. My name is Brittney. I'm a team member with the Sarah Michelle NCLEX Review, and today we are going to talk all about SBAR. This is something you are likely to see on your exam because as nurses, this is something that you are going to use daily. Clear, concise communication is essential to caring for our clients, whether we are giving report to another nurse or we're communicating with a provider. We're going to break down the different parts of SBAR and run through a couple of examples to help us practice what to include in our SBAR communication. Let's get started. So what is SBAR? Nursing SBAR is a framework we can use to structure client communications between nurses and providers. This is typically used when communicating with a client provider about medical situations that require immediate attention or action. It is also used in shift reports between nurses or when transporting and transferring clients. Do you remember what SBAR stands for? It stands for Situation, Background, Assessment, and Recommendation. Narrowing down the client information into these four categories can ensure that we communicate the essential details and keep our communications clear and concise. So you may be thinking, why is it so important that I know how to use SBAR? Can't I just talk about the client? Here are some reasons why using SBAR is highly encouraged when communicating about a client. Number one, using the SBAR framework is an easy way to organize the crucial information and eliminate the unnecessary details. Number two, in an emergency situation, it makes communication quick, systematic, and to the point. It makes it easier for the healthcare team to act quickly and resolve the situation. Number three, SBAR helps bridge the gap between nursing and provider communication types. It allows us to work efficiently with one another to best serve our client. And number four, it is a very helpful tool for new nursing staff who may feel a little overwhelmed when having to communicate a less than ideal situation to a provider. This framework is also useful for the nurses with experience to help them gather the pertinent information before making a call. In short, it is useful for all nurses. Let's take a closer look at each of the four categories. Okay, starting with S for situation. First, we want to identify ourselves and what role we are playing in relation to this client. What type of client information would you include here? For situation, we would want to give a brief summary of who the client is and what is happening with them. This can include the client's name, room number, care unit, and the reason we're calling the provider. For example, you might say something like, Dr. Jones, this is Mary on the medical surgical unit. 17-year-old Sarah was admitted after coming to the ED this morning with her parents. I would like to update you on her condition. This is just one example, but as you can see, the provider now knows who you are, why you're calling, and what client you're wanting to discuss before you move forward with the conversation. Okay, do you remember what comes next? Next is B for background. With background, you are going to give a short summary of the client's history. What do you think is important information that should be included in this step? Important background information would include the date and time of admission, the admitting diagnosis, past medical history, any lab or diagnostic test results, and even changes in the client's status. With this information, you are trying to paint a picture of the client for the provider, because in many instances, the provider is seeing multiple people during the day, and as the nurse, you want to make it clear who you're referring to. Using the same client as the last example, here's a suggestion of what you might say to describe the background. Sarah started reporting abdominal pain and vomiting this morning. Her pain is getting worse, and she describes it as sharp, stabbing pain that she rates at a 9 out of 10, and is mostly on her right side. She is on IV fluids running at 100 milliliters per hour, and she had a CT scan of the abdomen completed, and appendicitis was noted on the result. This continues to paint that picture of the situation for the provider in just a few sentences and fills the provider in on the current results. As we move forward, you can see how these 4 categories work together to complete the picture. Okay, next comes assessment. What should be included here? We would include any findings that support what we think is going on with this client. What findings would warrant notifying the provider regarding the situation? This is all that objective data, those physical findings to support what might be going on here. Here is where you as the RN can give your analysis of the assessment findings and your professional nursing opinion of what is going on. Ask yourself while preparing for the communication, what do I think the problem is? For example, the client from the previous slides has a diagnosis of appendicitis. The following is an example of what the nurse could say here. Sarah has had worsening severe pain and nausea. She also has significant tenderness, even with light touch to the abdomen, and her bowel sounds are minimal. I am concerned that with her symptoms and her test results, positive for appendicitis, that she might have a ruptured appendix. Remember, as the nurse on duty, you are the provider's eyes and ears on the client. Your professional opinion is valuable and can lead the healthcare team to getting the appropriate care for your client. Okay, what is that last piece of the SBAR framework? This is recommendation. Sometimes nurses, especially new nurses, may feel uncomfortable giving recommendations to a provider. The RN is the part of the care team who is closest to the client and has all the data. Again, your professional opinion matters. Do not be afraid to express your opinion and make a recommendation for the next steps in the client's care. Now, with our 17-year-old Sarah with appendicitis, perhaps the RN in this situation can recommend adding on as needed medication for nausea or request something to effectively manage pain. With your assessment and recommendations, there's a possibility that the provider could suggest a quicker surgical procedure if necessary. Okay, let's review the parts of the framework one more time. First, S for situation. Do you remember what we would include here? This is where the nurse would introduce themselves and give a brief summary of who the client is and what is happening with them. B is background. What would be important information to pass on here? Any pertinent background information needed for this client. This could be letting the provider know the date and time of admission, admitting diagnosis, or test results, changes in client status. A for assessment, what findings would warrant notifying the provider or another healthcare team member regarding your client. This is all that objective data. What is your analysis of what's going on here? You are how the provider can keep eyes on the client at all times. Your opinion is essential to client care. And R, recommendations. Here is where you can share professional opinions and any thoughts about what you think would be appropriate next steps in the treatment of the client. The RN is an essential part of the healthcare team and the client advocate, so don't be afraid to speak up. Okay, let's run through a scenario. The registered nurse is rounding on a 56-year-old client. The client was admitted to the unit yesterday after passing out unexpectedly. When the nurse helps the client to stand at the bedside, the client states they are feeling lightheaded and very dizzy. The nurse suspects the client has orthostatic hypotension. What information should the nurse include in the background portion of the SBAR communication? Number 1, admitting diagnosis. Number 2, the client name and room number. Number 3, physical findings regarding the client's status. And number 4, treatment suggestions. Okay, let's think back to our review. What should be included in background? What do you think is important background information about this client? Okay, so all of the above would be pertinent information to involve within our SBAR communication, right? Let's walk through it together to figure out which should be included in background information. Option 1, admitting diagnosis. This would definitely give the provider important information about why the client is at the hospital in the first place. So A would be the correct answer here, as it is definitely part of that background information. What about the other options? Number 2, client name and room number. What do you think here? Well, this would be a part of the situation piece of SBAR, how we introduce the situation to the provider or the care team member. What about the nurse's physical findings regarding the client's status? This would be part of our assessment. Our assessment is important information as the RN has the eyes and ears on the client and can observe any changes quickly. What about number 4? This would fit under recommendations. What does the RN think would be best for the client? Remember, don't be afraid to speak up and give recommendations to the provider based on what you think is best for the client. As a new RN, communication and knowing how much information is pertinent to relay onto the healthcare team is a skill that can be learned. The more you practice, the better and easier it comes for you. This is an important piece of nursing as we communicate regarding everything. As a new registered nurse, it can be intimidating to call report on a client as you transfer them from one unit to another for the first couple times. It can also be intimidating to call a provider, especially when they are on call overnight. And it can be even more intimidating to give recommendations about client care. But remember to keep practicing. Remember, you want to give them all the pertinent information about this client. That is what is so great about learning this framework. SBAR can help us collect our information in an organized, clear, and concise way so we can make sure to pass on the most important information and pertinent information in a timely manner. This can also help us build trusting relationships with the providers we work with. If we use our resources, we can be better prepared to care for our clients and communicate their needs. That's all for today. Thank you for joining us again. Make sure you hit subscribe so you don't miss out on the next Sarah Michelle NCLEX review video.